Correct. So we would work with the legislature as we have throughout the year on emergency spending allocations through working with the Joint Legislative Budget Committee and thinking and making sure that we're identifying and working with them collaboratively on how to address these emergency expenditures that are driving real costs that impact the budget.
Got it. And so will the proposal as it's currently written, will it require legislative approval? I understand he's going to work with legislators on that, particular spending, but will they need to ultimately approve it, or can he just spend that money? Since
we've been in the COVID-19 emergency, we have this account, the disaster response emergency account, and that is the money that we do notify the legislature when we're transferring money into that account, and then we've had a regular cadence of meetings and briefings, especially when exceptional new expenditure items are coming up, and so we can continue to do that. So the short answer, again, sorry I started with the long answer, is that we do not need approval to expend that money because it's part of the overall emergency response.
Got it. And just to confirm, that figure, I understand it's an estimate, but it doesn't currently include any federal money that
it doesn't.
Okay.
So it's also just an estimate of what the spending is. It doesn't necessarily assume how it's paid for. We wanted to make sure and hold space in the general fund, but there's an opportunity for it to be offset by federal funding. Again, we put this budget together before we knew what the final federal actions were going to be. The bottom line on vaccines is that real-time strategies are changing and adjusting, and the money to make sure that distribution goes well and expedited we will spend what we need to spend on that from the emergency allocations.
Got it. And then I just have one question about the supplemental payments that Newsom has proposed for low-income families.
Yeah.
So the way I understand the way the governor is proposing that those be allocated is you would take the families who received an EITC benefit from the 2019 tax year, so those who received it last year, and then you would also give it to ITIN filers who will be eligible for the 2020 year, so who are filing their taxes this year. Will that leave out any families who were not eligible in 2019, who are not ITIN filers, but who are eligible in 2020?
Possibly, and that's something that we're looking at. I think when we put this proposal together, I think this is again before the federal government acted and to extend the UI benefits. The plan was to get it out as quickly as possible, and because the EITC filings really are very dependent on you getting your W-2 and filing your federal tax return at the same time, those deadlines meant that those individuals would not get that payment until March, April, which is when most EITC filers do file. And so we wanted to go quickly, and that's why we used the 2019 recipients as the pool. Certainly, there has been a lot of changes to people's individual household income, and there are potentially some individuals who didn't qualify in 2019 that could qualify in 2020. And so that is something that we are looking at, and we're continuing to work with the legislature, but that is not part of the proposal because the idea was to go quickly and get that stimulus out on the street as quickly as possible.
Got it. So at this point, anyone who might be left out in that sort of gap, the governor's proposal is not to cover those people at the moment. But it's being
the $2.4 billion reflects an estimate. The $2.4 billion in expenditures reflects an estimate based on the 2019 filers, plus our estimate of who would have been eligible, who are ITIN filers that were not eligible for the 2019 tax year, but will be in 2020.
Got it. Thank you so much.
Angela Hart, Kaiser Health News.
Yes.
Thank you, Keely. Thank you, Keely. I want to wanted to just run through some questions, really, on the three of them for fact checking around the COVID proposed expenditures. Can you hear me, okay, Keely?
Yes, I absolutely can.
Okay, thank you. I just want to. The governor presented a slide showing $4.4 billion for testing and for vaccines and tracing. In the budget, when it talks about those things, it talks about those programs, those funding for the programs as it's already passed. So I just want to be clear, that $4.4 billion, is that a new proposed expenditure in the budget? And if so, can you point me to where that is broken down?
Yes, so it's on page 46. And this is a table that you will be familiar with because it's one that we've been updating throughout the pandemic, and we actually updated it a few times this fall since the Budget Act estimate. Again, these are slightly different because these are estimates. This is an emergency. It's dynamic. We do try and project and plan some expenditures, and that's what the $4.4 billion reflects. So, but the $4.4 billion is in comparison to what was included in the 2020 Budget Act, and so some of it are related to things that are already in process, like the Valencia lab, like the increased contact tracing that we've been doing, like all of the CDCR emergency expenditures to manage and reduce the spread in the prisons. So it is a slightly different thing because we are in this emergency, and it's a complex emergency with a lot of different lines of effort. And so we're really trying to make sure that the people of California have the transparency and understanding of where the money is going in the emergency.
So what's the right way to explain that? It's not, sorry, I just have a couple.
So the budget, I would say the budget reflects updated estimates of COVID-19 emergency response of $4.4 billion additional money.
But that's not a new proposed expenditure, correct?
No, it's just some of them, again, it's all coming out of the reserve, so it is not brand new. I guess the answer is right. It is not brand new. It's an updated estimate.
Hi, Keely. Nicole Nixon with Cap Radio. I see 2 new offices being created here, housing accountability and healthcare affordability. Can the administration just create those offices, or do they need a bill from the legislature to do that?
So not a new office in housing, but a new office of healthcare affordability. And that's something we will need to work with the legislature on establishing. It's something we've been working on from pre-pandemic times. Really important to increase cost transparency and also work to reduce the cost of healthcare so we can move more closely to expand healthcare to all Californians.
And then can you just briefly talk about ideal budgets for these?
Oh gosh, thank you. I don't know if I have that at my fingertips, but I will get that for you. The other office that we're creating is within the Department of Healthcare Services, and it's related to Medicare and innovation. We look forward to working with the next administration at the federal level on different ways that we can leverage our state's Medicaid system and the Medicare benefits that are obviously received by many millions of Californians to really expand the long-term care and supports that are available to individuals who are not on Medi-Cal, but are on Medicare.
One more question. I'm sorry if this has been addressed. I see on homelessness, $1.75 billion. Is that mostly for room key and home key? And is that all that's in the budget? And to me, that says that these projects have been successful. The governor just wants to spend money building on them.
Yes. So $1.75 billion is the resources that are dedicated directly to homelessness. It's all reflects investments in additional infrastructure. $750 million will build on the home key efforts to purchase motels around around the state that really provide a very good and cost-effective way to stand up a lot of housing quickly. But then we have two other additional strategies, recognizing that there are a lot of complex needs in the homeless population and there's different continuum of care that's needed. We have $750 million for healthcare services that will specifically support grants to counties to build or to purchase facilities for short-term mental health stays and to support individuals that are experiencing mental illness. The second piece is $250 million through the Department of Social Services to really take extra care to purchase and expand or rehabilitate our residential care for the elderly homes, which are small homes that are an incredibly important a part of our senior housing continuum. And so we want to make sure and wrap around those homes to both preserve and grow the availability of those low-cost options for seniors.
Jackie Fox, Cal Matters.
Yes.
Hi there. So the budget document, thank you so much for taking these questions. The budget document references $1.3 billion in food assistance for California. And I'm wondering if you are getting information about what that will look like. Is that more pandemic EBT or continued SNAP benefit or something new?
Stay tuned. I mean, we're checking websites daily and also working directly with our members of our staff that work in Washington, D.C. to make sure that we're following all of the guidance that the federal government's putting out on those new monies. So we will have to get back to you on what exactly that additional money will be able to be allocated to.
Hi, Keely. It's Alexi from the San Francisco Chronicle. I just wanted to clarify something you mentioned earlier. I think you said there were about $1.3 billion in suspensions that were being reversed. This is separate from the program cuts that the state had hoped to use the federal money for? So could you clarify what those are?
Absolutely. There's some confusions about that. There were two different sets of reductions last year. There was these programs that we were suspending, and they were not suspended in the current fiscal year. They were suspended starting July 1 of 2021, and most of them January 1, 2022. And so those programs have not been cut. A lot of them are recent expansions to the state's health and human services programs, but they also include a 7% reduction in IHSS, as well as some reductions in provider rates. So those things have not been cut. They weren't cut last year, and now we're actually proposing to further delay those suspensions. We keep them on, the governor, we have proposed to keep them on the books, if you will, for future years, because we obviously do have structural deficits starting in 22-23, and it may be that we will need to use those suspensions to help balance our budget. The other thing that you're referring to is the trigger cuts, or the cuts that went into effect that we were hoping, that went into effect July 1, but we were hoping for federal funds to buy those cuts out. Those cuts happened starting July 1, and we have various proposals that make additional investments in all of the areas that were cut. The judicial branch, UC and CSU are both getting 3% growth. The judicial branch is getting 3.6% growth, I believe, a COLA there, as well as child support services. There have been restorations made in that program as well, given the revised revenue estimates. And then, of course, our state employees, I talked about that earlier. We hope that we have additional money to be able to restore the budget year reductions, and we will make a final determination in May, and we will work through the collective bargaining process on implementing that determination.
Hi, Keely. It's Adam again.
Hi.
Thanks for doing this. I think earlier you said we're expecting about $100 billion from the federal stimulus. Is that right?
Yep, yes. And we have a table actually in Chapter 1 that reflects, it's on page 5. The vast majority is going to people, which is very important. $20 billion in unemployment insurance benefits and $18 billion for economic impact payments. So that stimulus was really so important to the nearly 4 million people still receiving some form of unemployment, and that will extend through March.
Thank you.
Well, thank you, everyone.